Dr. Tabar, we hear from our audience all the time, and there is so much confusion when it comes to the task force guidelines for mammography screenings and the age. What are your recommendations?
Well, Lisa, there is no true breast cancer expert who is in favor of the American Task Force recommendations. Because we have solid scientific evidence coming from 8 studies, strict randomized controlled trials, that show that early detection saves life in women 40 to 74. And because of the different growth rate of breast cancer according to age and histologic type, we also know what we should recommend when concerning interval. Okay. You see, there is nothing more harmful than letting a breast cancer grow to an advanced stage, palpable, big. And the US Task Force, God only knows why, they certainly do not recommend screening at all for women 40 to 49. But we have the scientific evidence, so why did they throw it out?
Why are they changing it?
And why do they change the 1-year interval to 2-year interval? What do you think the cancer is going to do in an additional year? It's going to grow.
Keep growing.
It's going to keep growing to the undesirable size. So this recommendation is actually a step backwards. The true screening experts don't understand where this comes from. Well, of course, there was a group of no experts. So there will be a lot of more advanced cancer, and radiologists and clinicians already know that indeed there are more advanced cancers and more women are going to die. Professor Hendrick from Chicago University calculated and published that 65,000 more women would lose their lives from breast cancer in the coming 10 years if you followed the task force recommendations.
Okay.
The experts say, don't do that.
Don't do that. Okay, and go with your gut. If you feel that you need to go,
No,
that
actually,
you should go.
You should really attend screening when you are 40 and above, and you should do the yearly screening or with maximum 1.5-year interval.
Thank you. Thank you, Dr. Laszlo Tabar, the breast cancer research expert as well as the mammography expert right here at Breast Cancer Answers. I'm Lisa Schneider-Cipriano.